Independent RX Forum is sponsored by Wellgistics Health. Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum. I'm your host, John Beckner, and I'm joined today by my friend and co-host, Mr. Ed Cohen.
Well, John, thank you for having me once again, and I'm looking forward to another robust conversation about the future of pharmacy practice.
And to remind our viewers and listeners, we are live streaming from the NCPA annual meeting in Columbus, Ohio. It's our day 2 of our live streaming podcast, and we're really happy to be doing this, and really glad that you folks have tuned in today. Very excited to be talking to our guest, who is Lura Thompson. Lura, welcome.
Thanks for having me. I'm super excited. This is actually my first podcast.
Oh, wow.
My husband, he does a podcast for some local sports, and I like to give him a hard time when I listen. You have some good criticism.
Well, you can also boast that not only this is your first podcast, but you're being live streamed as well.
That's right.
So, yes.
He's probably going to want to have you on as a guest. I'm sure you can talk sports. But anyway, is by way of background, Laura's managing network facilitator for CPESN Virginia. And, Virginia's had a lot of activity going on with respect to payer programs. And the first thing I want to try to focus on today is a vaccine hesitancy initiative that the network has been involved in. And, maybe we can talk a little bit by way of background. Vaccine hesitancy continues to be an issue. Particularly with COVID vaccine and certainly with even influenza, we still have some concerns about that. So why don't we start out with that?
But before you start out with that, if you might, tell us a little bit about yourself.
There you go.
How did you get to this position? Yes.
Okay, great question. Well, I actually started out in retail. I did retail for a couple of years and decided I felt in this kind of stuck place that there was more that I wanted to do, but living in the area that I'm from, it's very rural. There's not like a big hospital that I could go work for. I wanted to stay where I was from. And so I thought, I probably should have done residency at that time. And so I did. I went back after 3 years of working, which was hard, did a residency, and my residency was actually under a grant to work with a local provider's office and a local pharmacy, connect the two of them by creating a chronic care management program. And I did that. Oddly, the timing of it, COVID hit in the middle of it. So things were interesting, but it ended up being good because with chronic care management, you don't have to see the person face to face. So there were actually patients that I was able to continue seeing and meet with and have interventions during the pandemic. So it was really putting the system to the test. And after my residency, the physician I was working with was like, we got to keep this going. Like, what are your plans? And it really got my wheels turning. There's got to be other people out there that want to do this and that can do this. And I really didn't know about CPESN at the time. I heard about it, but I had no idea, what it really was. And so I continued those relationships. I worked with the Department of Health and the local pharmacy association to help other pharmacies implement those programs. And in doing so, it got me connected with a whole different group of people, CPESN being one of those. I was asked to be a co-facilitator for CPESN Virginia, which ultimately led to me working with the USA team as well. Mm-hmm. And it's just been like, I equate it to, I felt like I was on Misfit Island. I'd found myself a little bit. Like, these people think the way that I do. Like, community pharmacy is not dead, and there's so much that we could be doing.
Yeah, lots of opportunities. And maybe you could talk a little bit about your role as a managing network facilitator, all the things that you've been involved in. That's probably a few more than you've wanted to be.
No, I've laughed sometimes, like a good laugh, right? Because when I took it on, it was like, oh, it's a couple of hours a month, and we meet with pharmacies and we do these programs, and I'm like, okay, that seems simple. And now, boy, was I wrong. Like, it was so much more than that, but in a good way. We have come so far in the last couple of years since I started, and John, we're fortunate enough that he serves as a luminary for our network. But we have this incredible team of luminaries, leadership in our state network, and I truly believe that you have to have a good foundation. It's not just me. We are a team, and I couldn't do it alone. But wow, when I first came on, we had, I think, like a smoking cessation grant and then one other payer program. And now we have multiple payer programs. We are negotiating with NCOs on these programs and payment. And in my mind, pharmacies have been struggling. And my passion, I guess, in a way, you asked me earlier, my passion, it's always been pharmacy and helping people. But it's almost shifted in the sense of I'm now passionate about pharmacy and how many pharmacies can I help and expand that net to help the most people that I can. And ultimately, that's through community pharmacy. It's helping so many more people that way. We got to keep these pharmacies alive and doing these programs and having all these patient interventions. So it's almost like my passion shifted a little bit, but it's been an honor to serve as a network facilitator for Virginia and see all these pharmacies, boots on the ground every day, what they're doing for their patients. It's very inspiring.
Well, your passion certainly comes through loud and clear, and I think the name of the game today is access to these payer programs, and Virginia's been very fortunate to have gotten access to these programs. That certainly CPESN USA and the role that you play, you played a big part of that. And I think one of the more interesting programs is a vaccine hesitancy program that we've been involved with lately. Why don't you share with our listeners what's been involved with that and what might be the next level of program with regard to that?
So we had the opportunity. It started out as an actual vaccine clinic program with the local QIO, so Quality Improvement Organization. And our Quality Improvement Organization it's a couple of states. So it's Virginia, Missouri, Kansas, and South Carolina. Mm-hmm. And that was how it started out, like early this year, on providing COVID vaccinations to skilled nursing facilities. Since then, it has expanded to all facilities, so long-term care, kind of adult daycare type facilities. We want to get as many vaccinations as we can. In the middle of that, then there was another opportunity on top of that to provide vaccine hesitancy education, and it was short of $1 million grant opportunity with C of S and the QIO. And so we have been running around with our hair on fire, it seems like, because it was a very short
good description.
A short program. We had a couple of months basically to throw this program together and get people trained to provide the education. And we were able, in my mind, to do that so successfully because we partnered with Health Equity, which, as we know, is a CPESN group. And I have some stats for you guys.
Please share.
The don't I misquote. I just got the newest data, so because it's still ongoing. We wrap it up at the end of this month. But in Virginia, we had 7 pharmacies provide vaccine clinics, and we had 17 enlisted to provide education. And we were able to provide 400 patient vaccine education interventions. And
wow.
The last I heard was 200, so it doubled literally in just, I think, a week, the information that's trickling in. And between all the states, we were able to provide 2,500 COVID shots and a total of 6,000 shots counting pneumonia and influenza. So I think that was something to really be proud of. And those statistics, I think, will make the QIO happy. And we're hoping to continue to partner with Health Equity and have more opportunities like that.
Can you speak a little bit to the intervention that you're doing with these patients that,
So what we're doing is Health Equity actually designed the education. And what the pharmacies can do is there's a pharmacist, and they can have 2 technicians that can do this training as like a specialist to provide this education. So social determinants of health. You're thinking of your like farm tech, community health worker type roles if you already have one. If not, they can do this training and this specialist kind of certification. And they're meeting with these facilities, and they're not only educating, nursing home residents, but also their staff and going into the facilities and providing education. Because, the facilities there's still a lot of facilities that don't have great vaccination rates. And for whatever reason, it seems like, and maybe this is the wrong assumption, but this is my assumption. It seems like we have all these vaccines out there now. We have RSV, and we have pneumonia, COVID boosters, and it's almost like decision paralysis. It can be a little overwhelming. And I think people really trust their community pharmacists, their local pharmacists. It's relationships that they've had. And it's not like, you're coming into a doctor's office. Our pharmacists and technicians are meeting them where they are. And they're coming in and saying, hey, let's talk about this. Like, what's the root of your lack of, vaccines? Is it because you don't understand what they are? Is it you've heard something maybe on the news or online, or a caregiver, or, let's find the root of the problem. And they've been very successful. You could tell by
the numbers.
Those numbers are really good. And I'm really glad that you mentioned staff, because that's always been a huge opportunity dating back to when vaccines first became available during COVID. There were so many healthcare workers, so many staff members that were reluctant to be vaccinated, and that it's still a problem.
And we're also vaccinating the staff as well. So if they want to be vaccinated, then they can participate.
So you're
not just residents.
So the intervention is for the resident and the staff, and both are eligible to get vaccinated.
So your primary focus is adults in long-term care or assisted living. Okay.
And what's the length of this program?
So we actually wrap it up October 31st. That's the last day.
Wow.
But I'm being optimistic in that it may wrap up officially that day, but that we'll get a renewal maybe possibly for next year for the 2025.
Well, certainly the numbers that you have shared support
Absolutely.
Renewing the program.
I've been very happy with our performance, I think. So I know the Health Equity team, they've really, one thing I did fail to mention, I do want to make sure I mention this if we have time.
We have plenty of time.
Okay. One of the things that they suggested for us, and I will say Virginia is not a new network, but I will say we've not really had a robust programming over the last couple of years. And so we've really thrown a lot at our stores in the last couple of years that I've been in this role. And I think it can be intimidating sometimes when we have all these care plan type programs, or, there's just so much opportunity. They don't know where to start. And one thing that the Health Equity team suggested was creating these regional facilitators. So we also have our luminaries, but these regional facilitators are like your pharmacist within these, what I would say your high-performing pharmacies. And maybe it's a luminaries pharmacy, or maybe it's not, but you just have that person that's really passionate, proactive in your pharmacy. And that was a huge success. I wish we could implement that with all of our programs, because what the regional facilitators did was they reached out to the pharmacies in their area because they already have that relationship and said, hey, here's a program opportunity. This is how I did it. This is how you do it. I'm going to help you. I'm going to hold your hand, walk you through it. If you're
peer to peer, right?
Peer to peer. And wow, I really think that's why the numbers were so great, because they were able to reach out and really help these pharmacies get going with these opportunities. because with this program, especially, a lot of these pharmacies already had the relationships with the facilities. They may have already have done a clinic, and they're like, oh, there's this opportunity. You can send out emails and full webinars all day long.
Yeah.
Right.
But when your friend down the street calls you up and says, hey, I just did this, it makes a difference.
Yeah. And these regional facilitators were able to be paid out of the grant.
They were.
Yeah.
They were. And I think they were worth every penny. It was a genius design, I think.
So got a couple more minutes left. Any other payer programs that you've been involved with in Virginia, or any potential ones that are coming down the pike that you'd like to share?
Sure. So we actually just relaunched it was originally called our telehealth program that we have with United Health here.
Right.
We relaunched it as like a community health hub, if you will, because the way it started out in Virginia, and it's expanded to Carolina and Florida, and it's actually going to be expanding to a few other states, hopefully, is that there's the option for these Medicaid patients to come in and see a provider through a telehealth platform called Dr. Chat. But then they can also receive point of care testing by the pharmacist, and they can bill through the eCare plan to do that program. So we're excited that that's expanded and relaunching, and seeing some interesting interventions through that program as well.
Well, Laura, Virginia's lucky to have you.
I'm honored to serve
And,
in Virginia.
so we just need to keep the momentum going. And
Absolutely.
thanks for all that you do. And thank you for joining Ed and me on our podcast.
Couldn't wait to meet Trey, and you have a great view of the chef.
We
Yes,
do
we
have a
do.
good view. Thanks again, Laura.
You guys.
Take care.